If you have thyroid disease, including autoimmune Hashimoto's disease, or even Graves' disease, or really for that matter, any kind of chronic health problem, then struggling with sleep or insomnia is no stranger to you. And if you're interested in learning more about the potential causes of your sleep problem, then stay tuned, because in today's video, I'm going to be sharing with you 5 things that I've seen over and over again causing sleep problems with my patients. Hi, I'm Dr. Hagmeyer, and I'm the clinic director here at drhagmeyer.com, where we help patients from all over the world find answers and solutions to problems they've suffered with for years. Today's video is all about sleep. Whether you have sleep issues that have just started or you struggle with sleep for the last 10, 20, or 30 years, I want to share with you some of the things I think about that are often missed when it comes to working and assessing with patients with sleep disorders. In today's video, you're going to learn some of the potential causes of why you struggle with sleep, why perhaps falling asleep is a challenge, or why staying asleep is a challenge, or perhaps you have problems with both. I'll talk about some of the underlying metabolic conditions that cause sleep disturbances. I'll talk about some of the supplements that can help with sleep. I'll talk about some of the foods you should avoid if you're struggling with a sleep problem. And if you stay with me all the way to the end, I'm going to share with you some lifestyle tips that you can implement tonight that may even help you sleep better tonight. You know, whenever we have problems with sleep, it becomes this vicious cycle. You can't sleep at night, and so by the time morning rolls around, you wake up tired, you have no energy, you're run down, and so you make some coffee, or you drink some soda, or you way to work, you take an energy drink that's loaded up with caffeine. Now comes nighttime, and you're back to tossing and turning and not being able to fall asleep. So you wake up tired again. This vicious cycle goes on and on and on and on. And it's a very dangerous pattern to fall into, because there's some very serious long-term health consequences that sleeping problems can have on you. So there are 6 things I want you to think about, and things that should be on your radar. And if what I just described is something that you can relate to, you might want to jot these things down and begin to take notes. Things I think about are cortisol and melatonin levels. I think about pain levels. I think about drops or changes in blood sugar. I think about the fight or flight neurotransmitters. I think about the COMT gene. I think about estrogen dominance. And then I think about the relationship between glutamate and GABA imbalances. Let's unpack some of these and get into how these major things that are overlooked can be causing your sleeping problems, and ultimately what you can do naturally to sleep better. Let's first talk about cortisol levels. Number 1, this is a very common finding I see with many patients who struggle with fatigue that's also accompanied by insomnia. One of the things we see very often is high nighttime cortisol levels. You see, cortisol is a hormone, and it's made by the adrenal glands, and these glands sit on top of your kidneys, and they make 3 main categories of hormones that can be causing insomnia. As I go through these hormones, I want you to ask yourself if you can relate to some of these symptoms, because if you can, stay tuned, and I'll tell you what you want to do to start correcting and start to balance these. And again, if you can relate to many of these problems that we're talking about, again, it becomes important to look at these adrenal glands. The first group of hormones is produced by the adrenal glands is something called your mineral corticoids, right? Now, the most important one here that we want to think about as it relates to sleep is aldosterone. This is a hormone that helps regulate the body's salt and water levels, which in turn regulate blood pressure. Now, the problem is that low levels of aldosterone will cause the kidneys to excrete or lose excessive amounts of sodium and chloride, and consequently, when you lose sodium, you lose water. This ultimately leads to things like dehydration and low blood pressure. Low sodium, obviously, as well as low chloride, for example, these are electrolytes, and when they become imbalanced, you'll most likely see them experience symptoms like muscle twitches, maybe heart palpitations, maybe you feel like your heart's racing. You're finding yourself craving salt. You're fatigued on a regular basis. You experience dizziness. Maybe you urinate very frequently, and I'm talking 10 to 15 times a day. Or you have problems with your blood pressure. Maybe you have headaches or muscle spasms. Maybe you walk around in this state of confusion and sometimes restlessness. Now, do you think those things might be causing you to have insomnia or toss and turn throughout the night and lose sleep? I bet you they will. These, again, are all symptoms that are associated with low sodium caused by problems with your adrenal glands. Now, the next category of hormones made by the adrenal glands that could be causing problems with staying asleep and even falling asleep are what are known as your glucocorticoids. These are really important. This is where I see the bulk of problems related to sleeping disorders occur. The most important hormone here as it relates to sleep is the hormone called cortisol. This is a hormone that's involved in almost everything. Cortisol is necessary for thyroid function. It's necessary for ovarian function. It's needed to regulate inflammation. It's needed to regulate your blood sugar. It breaks down fats and allows those fats to be used for energy. It helps maintain the health of your bones. It helps regulate the secretory component of secretory IgA in your gut, which helps fight off infections. But also one of the things it does, which is very important, is that it's a part of the fight or flight hormones. If you look at this illustration here, you're going to see that all these things that cortisol can influence can impact sleep. So if you ask yourself, do you suffer with hormonal imbalances or thyroid problems or joint pain or headaches or fatigue in addition to insomnia and sleeping problems? You don't want to end up in a fight or flight state before you go to bed. You can imagine that it becomes very, very challenging to fall asleep. Many research studies, like the one that you see here, shows us that high cortisol levels can cause insomnia. We also know that in times of stress, our cortisol levels rise. And as the cortisol levels rise, this lowers our sleep hormone called melatonin. Melatonin obviously helps you feel sleepy. So when you have low melatonin levels, you don't feel sleepy, right? And that can be caused by those high cortisol levels. So if you're a person who takes melatonin, like so many people do, and you don't notice it helping, a different strategy might be one that focuses on reducing the high cortisol levels, which in turn improves your low melatonin levels. And the best way to determine if someone has high cortisol levels is, of course, through testing. There are 3 ways to test cortisol levels. One is in the blood, the other 2 are in saliva and urine. And again, this is not something you can guess about. I believe the best method of testing cortisol levels for people who struggle with sleeping issues is going to be done through a cortisol saliva test or a cortisol urine test. Now, there are a couple of problems that we see with a blood test as it relates to cortisol and sleeping. One of the biggest shortcomings is that it only involves a 1 sample collection. And this collection is often done in the morning when cortisol levels are normal, right? So if you have 1 sample of cortisol and it's done in the morning and that level is normal and you don't test through a saliva test, you're going to be missing the problem with high cortisol levels perhaps later on in the day or even later into the night. Because who's going in to have blood work done at 9, 10, 11, or 12 o'clock at night? The answer is nobody, right? So a cortisol saliva test is unique here in this regard, is that it can measure the cortisol levels in the morning, in the afternoon, in the evening, and then right before you go to bed. This obviously gives us the most accurate and complete picture of the total cortisol production throughout the day, as well as what's going on with the rhythm and the release and the pulsing of that cortisol that's done through the natural cyclical progression of cortisol output through the adrenal glands. That was a mouthful. But again, all of these things contribute to insomnia. Now, I want to show you a couple different things here. These are some tests that I want to show you that are some recent patients that we worked with that show the problem between cortisol levels and sleeping issues. The first example here is a patient of mine who wakes up and they're exhausted. They toss, they turn all night long, but they have no problem falling asleep. In this test, you're going to notice that this patient has a high morning cortisol. But if you look at the evening cortisol, you're going to notice that that's normal. This is a sleeping pattern that's very characteristic of having high morning cortisol levels that are rooted or caused by a blood sugar problem. Because one of the functions of cortisol is to arouse the brain, as well as the body, as well as regulate your blood sugar levels. People who are diabetic, people who are insulin resistant, people who have bouts of hypoglycemia and hyperglycemia, these are people that are all at risk for insomnia and sleeping issues. If you have a blood sugar level that's dropping at, let's say, 2 a.m. or 3 a.m. or 4 a.m. In the morning, this can be seen as a stress response to the body. And the way the body deals with this low blood sugar is essentially as it releases cortisol, and it's going to release adrenaline. And of course, both of these hormones are going to wake up your brain, wake up your body, and think that it's time to get up. So here's the key. If you're a person who can fall asleep with no problem, but you find yourself waking up at 2, 3, 4, you're tossing and you're turning every morning, then this sleeping problem might be rooted in actually a blood sugar problem, especially if you have high morning cortisol levels tested on blood. And again, this becomes an important scenario to look at. Now, a while back, I did a video on the connection between blood sugar and thyroid function, and I highly recommend that you watch this video if you suspect a thyroid blood sugar component to your sleeping problem. And to be quite honest, if you don't have a thyroid problem, there's so much good information on the strategies for sleep that I still would recommend that you watch that video as well. So how would you know if you have a blood sugar connection to your thyroid? Because I'm going to tell you that if you're basing this on blood sugar tests, a glucose test that you would go in and typically have during a routine blood test, this is going to miss it every single time. One of the forms that I like to look at that basically helps us kind of begin to think about a blood sugar problem, and it's a form that I have all new patients complete for me prior to becoming a patient, is called a metabolic assessment form. This form allows me to see various symptoms that may point to a blood sugar issue. Now, if you look at this list here, these are the symptoms that are related to blood sugar issues, and if you can relate to half of these, it's very likely that your insomnia and your trouble sleeping is rooted in some kind of blood sugar problem. If you want to watch the video that I just referenced, the one that talks about the blood sugar and thyroid connection, I'm going to leave a link in the description of today's video. Again, that video is titled 12 Tips to Balance Out Your Blood Sugar When You Have a Thyroid Problem. And like I said, even if you don't have a thyroid disorder, in other words, you haven't been diagnosed with thyroid disease, again, there are a lot of good tips that are packed into that video that, again, I believe that are worth watching. Okay, so let me show you a few more things. The next patient I want to show you here is a patient who can't fall asleep, right? This is a person who feels fatigued. They feel tired most of the day, but come nighttime, it's like a gust of energy hits them, right? They are wired and tired all at the same time. They get this second wind, so to speak. This is a patient who is physically fatigued, right? They're tired and they're run down, but their mind is going, right? Or she is restless and they can't settle down. Again, their mind's racing, their legs are twitching. This is the person who goes to the gym at 10 or 11 o'clock at night when they really should be in bed sleeping. When you notice this, all right, when you notice this scenario playing out in your life, one of the potential scenarios here is that you have a high evening cortisol levels, and that's causing the insomnia, and that's causing the trouble getting to sleep. This, again, why it's so important to run a saliva cortisol test, because this person here, you'll notice here in the morning, is normal. But then as the night goes on, as the day progresses, the levels are elevated, right? Again, very, very important. This is, again, a typical patient who comes to me saying, my doctor ran all of these tests, I've spent all this money, everything is normal. Sometimes you have to use a different kind of test that digs just a little bit deeper into the problem. Now, it's important to realize that there are many factors that can throw off your cortisol levels. Studies show that high amounts of cortisol are pulsed out not only in times of stress, but also in times when the body has chronic inflammation. I see a lot of my patients who have insomnia are often patients who are also chronically inflamed. And so what do I mean by chronically inflamed, right? This might be the person who has nagging neck pain or nagging back pain, might be a shoulder injury, might be a knee problem. Maybe there's a lot of degeneration in a knee. Maybe it's a person who has some problems in their teeth, right? Maybe they have an infection in their tooth. Maybe it's a person with fibromyalgia. Maybe it's a person with an inflammatory autoimmune disorder like lupus or rheumatoid arthritis or Hashimoto's disease or Graves' disease. It might be the patient with inflammatory bowel disease such as Crohn's disease or ulcerative colitis. It might be the woman with polycystic ovarian syndrome, PCOS or endometriosis, really all of these chronic inflammatory conditions. Again, these are all health problems that can create and contribute to a vicious cycle of adrenal dysregulation, which then call upon the adrenal glands to pulse out that cortisol and adrenaline, leading to sleep problems. So what do you do if you are chronically inflamed and you have trouble with sleeping? Well, first let me tell you the things that I tell my patients and prospective patients when it comes to insomnia. And then I'll tell you about some of the natural things that you can do that may help. All right, so number one is this. Change the way you think about sleep. And here's what I mean by that. I want you to start thinking about insomnia and sleeping problems not as a cause to your problems, but really a side effect, right? A diagnosis of insomnia tells us nothing about what's causing the sleep problem. A lot of people are just so happy to find out that they've finally been diagnosed with sleep apnea or insomnia, But yet, what's causing the sleep apnea? What's causing the insomnia? And again, these are the things that relate to today's video. These are the things that need to be explored. And again, of course, by watching today's video, a handful of things, we can dig into these things and we can begin to explore how these may relate to you. Number two, always think about the big picture when it comes to your chronic health problem, right? There are many potential metabolic problems that are causing your insomnia and your sleeping trouble. And sometimes, even though these other health problems like inflammatory bowel disease or fibromyalgia or thyroid problems or PCOS may be properly managed, they may not be managed well enough so that those health challenges are still a contributing piece of the overall picture that still needs attention. So again, this is why if you're not already working with a doctor who specializes in functional medicine, then this is something you really either want to reach out to my practice and reach out to our practice, or you want to reach out to another practice that has experience in these areas. The key here is to look at as many of these health puzzle pieces as you possibly can to complete that big picture. And finally, number three, the proper testing will show exactly where your body needs support, but also where it doesn't need support. Right? You can't begin correcting something and improving a sleep disorder if you don't know where the problem is stemming from. So if this is something that you need help with, contact my office. Let's figure out what could be some of the potential root causes behind your insomnia. So the next thing I want to talk to you about is some of the natural remedies that can help address this high cortisol, this high blood sugar, this inflammation behind the insomnia, and of course, other problems with staying or falling asleep. Let's start first with what might be potentially, or what could be, what could potentially help your high nighttime cortisol levels. Again, if you have high nighttime cortisol levels, one of my favorite supplements, which can usually help with this, is something called phosphatidylserine. Phosphatidylserine has shown in numerous studies that it can blunt the levels of ACTH. And ACTH is made in the brain, and it basically tells your adrenal glands to make cortisol. And so by blunting this cortisol response, you're going to sleep better. Phosphatidylserine can do that. If you're a person who has inflammatory autoimmune disease, or you have fibromyalgia or rheumatoid arthritis, then one of the supplements, or I should say a few of the supplements that I really like to use and implement are going to be things like Wobenzyme Plus, or Boswellia Complex, or Tumoro XL, or Resveratrol. All right, these 3 or 4 supplements that I just mentioned, and there are a few others. These are some of my all-time favorites to start with when it comes to dealing with things like pain and the inflammatory component that can cause these excess cortisol levels. Again, I'll leave links in the description, in the description box. If you want to go back and you want to click on those links, there'll be information there for you as well. Now, there are a lot of additional herbs that I think can help with problems that are related to cortisol, and these fall under a category known as adrenal adaptogens, right? These are often used for people with insomnia. These adrenal adaptogens can help with problems where a person might have both high cortisol levels and low cortisol levels that are causing their sleep problems. Now, if you've never heard of the term an adrenal adaptogen before, essentially adrenal adaptogens basically help the body adapt better. In other words, if we have high cortisol levels, adaptogens can help with that. If we have low cortisol levels, there are adrenal adaptogens that can help with that as well. Adrenal adaptogens may be things like ashwagandha, rhamania, magnolia officinalis, panax ginseng. There's a few other adaptogens that are also very helpful, but those are some of the ones that I really think about. Now, a few more things that I want you to consider and remember is that when it comes to problems with cortisol levels, understand that when we talk about physical stress, chemical stress, and emotional stress, it's not just the people that are struggling with depression or anxiety or mental health problems that's causing this stress. It's the physical and chemical components as well, all right? So again, these are all things that can affect your cortisol levels. People who excessively exercise and work out and train, maybe these are intense athletes, right? Or professional bodybuilders or fitness, people involved in the fitness industry. They always have to look good. Maybe it's someone who runs marathons, people who are putting their bodies through intense physical exercise. Again, this might be someone who is exposed to a variety of different chemicals and toxins on a regular basis. It's people who have autoimmune diseases and have flare-ups. Again, the body's response to all of these stressors is the release of cortisol and adrenaline. The body doesn't care which one it is. So again, These are, again, the things I think about. Now, another category of hormones, but also neurotransmitters that the adrenal glands produce as it relates to problems with insomnia and trouble sleeping are known as your catecholamines, right? These are going to include things like adrenaline, noradrenaline, and even something called dopamine. I've talked about dopamine in another video. But these hormones and even neurotransmitters increase the electrical activity in the brain, and essentially they promote excitement and motivation and arousal in the brain. And while these are all good things to have in the morning when you first get out of bed, these are not things that you necessarily want to have high levels at nighttime, right? High levels of catecholamines are not going to allow you to fall asleep because, again, these catecholamines are your fight or flight hormones. Now, the interesting thing here about catecholamines is that they not only affect how you sleep, but they also impact your mood, your happiness, your focus, even your enthusiasm in life can be attributed to dopamine levels, right? So what do you do if you're noticing that you've lost that zest in life, you've lost that energy, that excitement, that enthusiasm, but you're also struggling with sleep problems, right? So pay very special attention here because here is something very, very important. If you notice that you have those symptoms, again, depression, lack of motivation, maybe social withdrawal, you now prefer to be alone rather than going out with friends. Maybe you become a worrier, right? You feel like you've lost that zest in life. You may also have a genetic mutation in an enzyme called the COMT gene or the COMT enzyme. In the last 3 or 4 years, I've been doing a lot of testing and seeing this show up in more and more patients that struggle with sleep problems. They have this mutation of the COMT gene. And again, like I said, I'm finding this problem in an overwhelming majority of them. So what does this COMT gene do, and why is it important for people who have insomnia and trouble sleeping, or even things like motivation and depression? Well, the COMT gene is one of the genes that's responsible for the rate of breakdown of your catecholamines. So in other words, this enzyme breaks down your fight or flight hormones or your fight or flight neurotransmitters. In the process of breaking these down, or in the case of a situation where we have a genetic mutation in this gene or this enzyme, we may have too many excitatory neurotransmitters, right? So again, this is involved in how you handle stress. It's in part how you tolerate pain, how you handle stress. Problems with the COMT gene are also seen with mutations in another gene, which I'm probably sure you're even more familiar with, and this is the MTHFR gene. All right? This may be another culprit behind your sleeping issues, your mood swings, tolerance to pain, your anxiety levels. Again, all things that are worth exploring when we talk about root cause medicine. So again, just a quick recap. So far in today's video, I've talked about high cortisol levels being a root cause of insomnia. I've talked about fluctuating blood sugar levels in the early morning as a root cause of insomnia. I talked about pain and inflammation being a root cause of insomnia. I talked about high levels of these catecholamines, these fight or flight hormones, these adrenaline and dopamine being, again, a root cause of insomnia, and how that's tied into the COMT gene. I also talked about various supplements that can help support these different problems. There are 2 more things that I want you to consider when it comes to root cause medicine and sleeping problems: hormonal imbalances and the glutamate GABA imbalance. Let's talk about how hormonal imbalances, how they affect sleep in both men and women. Now, whenever I think, or work for that matter, with a woman who struggles with sleep issues, I want to know if she has any of the classic signs of hormonal imbalance. I want to know if she's taking the pill, how long she's taking the pill, why is she taking the pill. I want to know if she's menopausal or perimenopausal. And the reason this is so important is that for many of these women, the most common culprit behind many of the perimenopausal and menopausal symptoms that are experienced are insomnia and trouble sleeping comes down to estrogen dominance. Estrogen dominance can show up in a few different presentations in women, and having too much estrogen in the body is not good for sleep, as you can see here in this study. When we talk about estrogen, estrogen will always be tested alongside progesterone so that you can evaluate for this estrogen dominance scenario. So a woman could have estrogen dominance if, 1, she has low estrogen levels as well as low progesterone, or number 2, it can show up where her estrogen levels are actually normal or even low normal, but her progesterone levels are even lower, right? And here's the thing, having estrogen dominance interferes with sleep quality because it's progesterone that has a calming effect on the brain and the body. And here's why. Whenever we talk about neurotransmitters of the brain, we classify them as either excitatory or inhibitory based on how that hormone or how that neurotransmitter affects the brain. Progesterone acts on specialized receptor cells called GABA receptors. And if you watched any of my past videos where I've talked about anxiety and depression, I talk about GABA being a neurotransmitter that really has a calming effect on the brain, has a calming effect on the body. Essentially, it's like putting the brakes on as opposed to pushing down the gas pedal. Now, the thing to understand about glutamate levels is that glutamate is like the gas pedal, all right? And when you have too much glutamate in the body, or in the brain for that matter, it's like putting down the gas pedal all the way to the floor, pedal to the metal, right? And here's why proper balance of estrogen and progesterone is so important. Here again is a study on progesterone, and again, showing why it's so important and why it needs to be balanced with estrogen. Again, progesterone induces sleep. It increases melatonin levels. It has a calming or hypnotic effect on the body and on the brain. Studies also show that progesterone is a potent respiratory stimulant. And what this means is that progesterone has been shown to decrease the number of central and obstructive sleep apnea episodes. How many people get diagnosed with sleep apnea and the only thing that is the solution is going on a CPAP machine, right? Well, there's much more to this story. So again, while there are many benefits of progesterone, please keep in mind that before you go out and start taking progesterone, it's so important, absolutely essential to be tested to see if and where you need those levels and when you need those levels. Now, I talked about estrogen dominance in women, but guess what? Guys, you are equally vulnerable to estrogen dominance. For many men who get diagnosed with low testosterone, the cause of their low testosterone is not always a problem in the testes. It's not always a problem where the testes have stopped producing testosterone. Sometimes the testosterone that's being produced is actually getting converted into estrogen. For men, this is called andropause, and this can be just absolutely devastating. For men, estrogen dominance shows up on testing in a few different presentations. Men can have normal testosterone levels, but they can actually have high estradiol levels, or they could have low testosterone and normal estrogen. The key here is to make sure you get your estrogen levels checked, as well as your FSH levels and your LH levels. So what can you do if you're a man or a woman who's struggling with estrogen dominance as a culprit, behind the insomnia and behind the sleeping problems? Well, the key here for both men and women who struggle with insomnia is always to get the proper testing. At a minimum, there are 4 tests that you should have done. And these can actually be done in blood work. You want to get your estrogen levels checked. You want to get your testosterone levels checked. You want to get your free testosterone levels checked. And finally, you want to get something called your sex hormone binding globulin levels elevated. Again, if your doctor won't run these tests for you, shoot my office a quick email and we can help you with this. As with any hormone imbalance, there are a couple things that really stand out to me, but these are especially important if you have thyroid disease or Hashimoto's disease. Number one, the thing that I want you to think about is always support the liver and detoxification pathways. This is just really so important. Number 2, support the adrenal glands with adrenal adaptogens. Number 3, eat lots of leafy green vegetables. This is going to be things like dandelion root, dandelion greens, kale, Swiss chard, spinach, right? These things actually help support your liver. And number 4, eat a lot of cruciferous vegetables, broccoli, cabbage, Brussels sprouts, bok choy. Again, all those foods that a lot of people don't like to eat. But again, start eating them. There's so much benefit to these in terms of how they affect your liver. Number 5 is eat more onions, eat more garlic, eat foods that are rich in fiber, foods that are rich in sulfur. Things like berries, things like chia seeds, flax, psyllium, again, all very important. One of my all-time favorite supplements that's specially designed to help with estrogen dominance is this supplement you see here called EstroQuench. This can be especially important if there are problems related to thyroid disease and estrogen dominance. So again, just a few important closing points for today's video is that if you're suffering with insomnia and trouble sleeping, staying asleep, or trouble falling asleep, number 1, it's very common for people with thyroid and autoimmune thyroid conditions to have trouble with this. So again, keep that in mind, thyroid problems. Number 2 is that there are a number of factors that can be responsible for insomnia in people with these conditions. We talked about several of them today. If you visit my website, you'll see a transcript of today's video that I provided some additional videos for you to watch and links and resources for you to read up upon these topics. So again, make yourself available to those. Number 3 is that there's many layers to insomnia. Again, we talked about high cortisol levels. We talked about blood sugar imbalances. We talked about inflammation. We talked about how high cortisol levels affect melatonin levels, especially at nighttime. We talked about estrogen dominance and how that affects the GABA receptors or the glutamate receptors in the body. We talked about inflammation. We talked about, again, some of those catecholamines, those fight or flight hormones. All of these factors that we've talked about today you can learn more about on my website. And number 4, while correcting sleep problems, including insomnia, can obviously be sometimes very challenging. Again, keep in mind that there's multiple causes. But the good news here is that once you have identified what that root cause is to the sleeping problem, there's no reason why you shouldn't be able to sleep better and why that sleep shouldn't improve. It may take time, but it'll happen. And with better sleep, you'll be surprised at how many other areas of your life and your health just begin to improve. So there you go. I hope you liked today's video. If you haven't subscribed to my YouTube channel yet, be sure to hit that subscribe button, get notified of when we post new videos, comment below, tell me a little bit about some of the struggles that you might be having with sleeping. And lastly, if you need help in improving your quality of sleep naturally, and perhaps you maybe just hit a brick wall, visit my website and look for the Start Here button, all right? Until next time, take care. Happy dreams.